Every single year, more than 10 million people around the world fall ill with one of humanity's oldest and most persistent diseases, tuberculosis, also known as TB. It's an infection caused by a bacterium called Mycobacterium tuberculosis, a tiny organism that can live in the human body for years, silently waiting for the immune system to weaken before striking. Despite modern medicine, TB still kills around 1.5 million people every year, making it one of the top 10 causes of death worldwide. This disease doesn't discriminate. It affects men, women, and children in both rich and poor nations, though it hits the poorest communities hardest. A global health threat. Tuberculosis spreads through the air when someone with active TB in their lungs coughs, sneezes, laughs, or even talks. The bacteria can float in the air for hours, and anyone nearby can breathe them in. But infection doesn't always mean illness. About a quarter of the world's population is infected with latent TB, meaning the bacteria are in their body but inactive. When the immune system becomes weak due to stress, poor nutrition, or diseases like HIV, the bacteria wake up and cause active TB, which is contagious and dangerous. Recognizing the symptoms. The early signs of tuberculosis can be subtle, a mild cough, fatigue, or weight loss. But as the infection grows, symptoms become more serious. A persistent cough that lasts more than 3 weeks, chest pain and shortness of breath, fever and night sweats, loss of appetite and unexplained weight loss. In some cases, coughing up blood. TB mostly attacks the lungs, but it can also affect the brain, spine, kidneys, and bones, making it a truly systemic disease. How tuberculosis is diagnosed. Doctors use several methods to identify TB. The Mantoux skin test checks if the immune system reacts to TB proteins. Chest X-rays help detect lung damage, and newer tests like GeneXpert can confirm the presence of Mycobacterium tuberculosis within hours. Early detection is vital. The sooner TB is found, the higher the chance of full recovery and the lower the risk of spreading it to others. Treatment and the challenge of resistance. Tuberculosis is curable, but the treatment is long and demanding. Prevention and protection. Preventing TB is possible, but it requires awareness and responsibility. The BCG vaccine, given in childhood, protects against the most severe forms of TB in children. For adults, prevention means testing, treatment, and good living conditions. Proper ventilation, balanced nutrition, and avoiding close contact with untreated TB patients. Health workers also stress the importance of DOTS, Direct Observed Therapy System, a program where trained workers ensure that patients take every dose of their medicine. This simple approach has saved millions of lives and prevented the spread of resistant strains. The human side of tuberculosis. Behind every statistic is a person, a father struggling to breathe, a mother isolated from her family, or a child too weak to play. In many countries, TB patients face stigma and discrimination. People are afraid to admit they are sick, which delays diagnosis and treatment. But TB is not a disease of shame. It's an infection that anyone can get. Showing compassion and support to those affected is just as important as medical care. When patients feel accepted, they are more likely to complete treatment and recover fully. Hope for the future. There is hope. Scientists are developing new vaccines and shorter, safer treatments. Some modern therapies can cure drug-resistant TB in just 6 months, compared to 2 years before. With continued research, public education, and government support, the dream of a TB-free world is getting closer. The World Health Organization's goal is to end tuberculosis by 2035, but that will only be possible if we all play a part, by spreading awareness, helping those affected, and breaking the cycle of infection and fear. Final thought. Tuberculosis is ancient, but it's not unbeatable. Millions suffer every year, but millions can also be saved. With early detection, proper treatment, and compassion, we can defeat this silent killer once and for all. Let's not ignore it. Let's fight it, together. Fact check summary. 10 million new TB cases every year, WHO, 2024. 1.5 million annual deaths. 500,000 drug-resistant TB cases. 25% of the world population has latent TB. BCG vaccine reduces severe TB in children.